should you have a family maximum for your DPC practice? I don't know if it's a controversial opinion, but I have an opinion on this, and there's basically a yes or a no opinion. Some people think, no, you shouldn't have a cap. Everybody should pay what they do because everybody's getting that level of service. I actually, as a pediatric direct primary care practice, we have a special interest in this because some families get big, and often families, because our prices are a little bit higher per patient, quickly reach that cap. And my opinion is that you should have a maximum out-of-pocket monthly cost for families, that once they've hit that, like once they've added up enough kids to get to that, then there's no additional cost to them. The biggest reason is because of the sticker price. Our family maximum is $300. I don't know a lot of patients that would pay more than $300 per month for their family, on top of their insurance premiums and everything else that goes along with their health care. I think that is pretty cost prohibitive for most families that we want to attract into our practice. The other thing that I will keep in mind is, as a family of 8 ourselves, we have 6 kids. Speaking as the dad who's a pediatrician, we hardly ever go to the doctor. But I have a lot of families that have large families. They're 4, 5, 6 plus kids. They are never coming into the doctor. One, they're just too dang busy because they got so many mouths to feed and so many places to run around and everything like that. And 2 is because they're very savvy. They know when they need to go in and when they don't. So they don't reach out about all of the minor things that younger families with 1 child or 2 children typically reach out for, because they've experienced it all before and they're just too busy for all of those little minutia. So I do think that you should have a family cap, and ours, we chose $300 per month, which has been very acceptable to families. Our fees are on the higher end. So babies start at $175 per month. It tiers down to school-aged kids that are $85 per month. So if you have a young growing family, your baby and your toddler are probably going to get you towards that max. And then everything beyond that is gravy. I mean, we don't charge extra or anything like that for those families, because once they reach that cap, they're going to be utilizing it essentially as anyone else. And so that's my opinion. I think that helps. Now, if I were to say, okay, I have a family of 4 or 5 and they're relatively healthy, why would they join if they're paying $450, $500 per month for the benefits when most of their kids don't come in every month? Most of the kids don't need anything every month. The finance, the math just doesn't add up for those families. And so they're not going to join. Whereas if I can get a family of 4 to join and pay that family max, the likelihood that they're going to use it as much as a family of 1 or 2 is quite low, because their kids are going to be older, they're going to be busy, they're going to have all sorts of things going on, and they're more experienced anyways. So that is why I think that it is wise to set a family max, because otherwise you're going to turn away a lot of really good families that are going to be low utilizers of your services.